Hello guys, how have you been? Let's talk today. So, it's already been a week and also the time to reflect. To reflect how our week has been both personally and professionally. We need to check with ourselves. Am I feeling all right? What progress I made throughout the week? Which healthier choices did I make for myself? Are any thoughts troubling me right now which I can solve by simply talking or taking actionable steps? This practice works not only while preparing for NEET PG but also us in general because we too are humans. So, today I want to share with you my NEET PG preparation journey, how my day used to progress like. So, I used to start the day with lot of motivation, with a perfect plan that I need to complete this topic, that topic. I used to maintain the same level of energy until 4 p.m. But after lunch, I don't know what used to happen to me. My energy wouldn't be the same. My level of enthusiasm wouldn't be the same. My battery levels go down and down after the break in particular. And from 7 to 9, I used to push myself saying that you got this, you can do this. And again, I used to note in a book what all I studied that day. So I used to maintain this book where I used to note everything which I studied in that particular day. Also note some interesting questions which I have come across, because after 2 or 3 days I used to forget what I read 2 days before. So since then I started doing this practice of noting whatever I read on a particular day in a notebook. So if after that, if I had that little bit of energy, I used to plan for the next day and just doze off to sleep, sometimes even without clearing my table bed in between books only. So this used to be my journey. Now everyone's journey is different. So I used to push myself, I used to keep myself motivated because the exams are only 1 month away, 2 months away. I used to say that and push myself, but it used to be very difficult for me after 7 in particular. Now I want you to share your stories in the comments below. How do you keep yourself motivated throughout the day? Your story might inspire someone. Also, do not forget to take time for yourself to reflect on your week. If you don't feel comfortable commenting below, you can also mail me your experiences. I'll share your stories next week on the channel. That way we can keep ourselves motivated too. So now let's revise what all did we study for about 8 days, because it's been nearly 8 days that we started this series, and it's important for us to do revision, to not forget things and also be in track. So on the first day we studied about the hypophosphatemic rickets and also how to get to that answer. Also that concept is very important. Please do check that again if you haven't seen that yet, or clear that concept, because hypophosphatemic rickets is a star concept which has a potential to be asked in the next exam also. And also we have seen the pathway of the vitamin D synthesis, that is the skin, liver, kidney. We have seen a different question of niacin toxicity, wherein the features are macular edema and macular cyst. And we also identified the test, that is the erythrocyte NAD concentration. This was all for the first day. Coming to the second day, we saw the drug interaction between the lithium and thiazide, and also thiazides were the preferred drug in the case of renal colic. Methylxanthines causing diuresis because of the adenosine A1 receptor antagonism. This is also an important concept which has a potential to be asked in the next exam. We have seen an image of diuretics and their site of action also. And the third day we have seen the Menzer index. This is a number question which I had for you, Menzer index. So Menzer index for differentiating thalassemia and iron deficiency anemia, that is MCV by RBC count. If you haven't noted this yet, please note this because this is very important. And also we have seen the values of folic acid to be given in a female with NTD, that's a neural tube defect. It's 4000 micrograms per day or 4 mg per day. What is the normal dose which we give in a female without NTD? You tell me that. And Hirschsprung disease, and Hirschsprung disease. We have studied everything about the Hirschsprung disease and also the histology image. You need to remember that because it has been asked only in the last exam. Imminent eclampsia symptoms. There the option were blurring of vision, headache, gastric pain, whereas pedal edema was not the symptom of the imminent eclampsia. Also we differentiated between chondroblastoma versus giant cell tumor. This happens in the kids, and also there is a stippled classification over here. Don't forget to revise these two things, and also aneurysmal bone cyst also. Differentiating between these three is very important. And coming to next, we started our series of INEET November 24 questions, wherein we studied very nearly since 3 days we have been doing that. So nearly we have completed since 4 days we have been doing that. So we have completed nearly 20 concepts, important concepts from INEET November 24. So we have seen the pediatric CPR guidelines. We have seen the examples of HAGMA. We have seen the ANA antibodies. I have linked in the description about the ANA antibodies video of Ranjit sir. That's very important. Factor 13 deficiency, urea clot solubility test. You have answered in the chat comments very beautifully the answer of pneumothorax. We have seen the papillary cancer management. We have seen the derivatives of neural crystals, where I marked ciliary muscles as the answer, but the answer was something else than retinal pigment epithelium, which is a derivative of neuroectoderm, not the neural crystal. Remember that point. We should not forget such kind of questions. And also we have seen the best modality for ureteric coli, that is NCCT, TNM staging of breast cancer. Let's revise that tomorrow because we keep on forgetting that the TNM staging of breast cancer. And also we have seen everything about jaundice. I asked you to read everything about jaundice. I hope you completed reading everything about jaundice, the pre-hepatic jaundice, post-hepatic jaundice, hepatic jaundice. They can give many questions revolving that topic only. We have seen the images of Hayes test and the Forsch's test images, the Vandenberg reaction, neonatal jaundice, breast milk jaundice, the values here, the Ames protocol. I will also pin this image. This is very important, the Ames protocol, because they can directly give that number of days and ask the management of that baby. And also we have seen the orthopedics questions, that is neck of femur fracture management. We have seen less than 65 years, more than 65 years. The management algorithm is very important, and the Trendelenburg-Steiner gate you have beautifully answered in the comments, saying that it's because of the gluteus medius muscle and also the nerve supply with superior gluteal nerve. This is also important. And we have seen LMN versus UMN lesions, factors affecting GFR. We have seen the oxygen oxygen dissociation curve, what happens when in the presence of stored blood. So we have seen the pediatric CPR guidelines. We have also come to a number question yesterday, that T half is equal to 0.693 into VD by CL. And also we have discussed the ectopic pregnancy question. I wanted you to answer this question. Ectopic pregnancy question was a tricky one. You have tried your best to answer it in the comments. I'll pin a video of Sakshi ma'am explaining this question very beautifully in the first 5 minutes of the video itself. Don't forget to watch that INEET recall. And also we have seen the pelvic diameters, the image. You shouldn't forget that, the true conjugate, the obstetric conjugate, the diagonal conjugate. They can ask any of that. So we have seen the different types of vaginitis, the ovarian tumor classification. So the germ cell versus sex cord stromal tumors. So also tell me, what are the types of germ cell tumors which you remember? All of this we revised all of this in the period of 8 days. If you have traveled with me totally and you invested at least like 10-15 minutes of your day, you wouldn't forget these concepts, because you remember someone telling you these with you, studying with you, telling that I made this mistake, you shouldn't make this mistake. So see, in 8 days we have nearly covered like 40 questions, I can tell. So that's it for today. Share your NEET PG journey in the comments below. I said Sunday is fun day because I used to usually revise whatever I read for the whole week on Sundays. So not reading anything new on Sunday, and I used to watch a movie compulsorily on Sunday to relax. So also tell me, what do you do for your relaxation? And I will pin all the important images from all the 8 days which we have been studying. Okay, see you tomorrow. Like, share and subscribe to this channel for such more informative content. See you tomorrow.